Welcome to Doctoring You, a place for better health through higher understanding. This Doctoring You presentation will focus on things you should know before visiting the emergency room. Join Dr. Su and guest Dr. Shan Liu in an informative discussion on preparation and steps related to visiting the emergency room. And now, Dr. Michael Su.
Welcome to DoctoringYou.com. We're currently recording in Boston, middle of August or late August, and we have here Dr. Shan Liu, who works for the Mass General Hospital Emergency Room Department. Is there anything that you would like to tell families who may not have visited emergency rooms and somehow, somewhere, they will need to go?
The emergency department's open 24 hours a day, 7 days a week. Patients should have written up a list of their medical problems, their medications, and their allergies. That would be really helpful for the staff, especially if English is not your primary language. So the physicians in the emergency department, or the clinicians and the nurses, are best trained to take care of emergencies, to make sure that you're not having a heart attack, a stroke, a fracture, intracranial hemorrhage. We're not experts in chronic conditions and the management of them. So families should know that since the emergency department doesn't have a clinic schedule, that oftentimes things are triage based. So the sickest patients will be seen first, and the patients who don't have as severe a complaint may have to wait. And because of that, I recommend people have an advocate or someone who's able to speak on behalf of your loved one. Oftentimes, we have to make split-second decisions on whether patients should go on a ventilator or breathing apparatus or get some type of treatment for stroke. And it's very scary for patients to make decisions with not very much time to think about it. And so it's a difficult conversation, but to get a sense of who is your healthcare proxy, who do you want to speak on your behalf if you can't make that decision yourself, and to think about things and have a conversation with your loved ones, with your primary physician, to decide, are these things that I want? Do I want to have a breathing tube? Do I want to have shocks if my heart stops? And those are very difficult conversations, but best to have them beforehand rather than in an emergency situation. Having discussions beforehand when patients are not too ill regarding their wishes in terms of their end-of-life wishes is very important before the emergency does happen.
So I think, as a consumer, I think it's best to recognize that fact when you go to the emergency room, that the sickest always comes first.